Management of pre-gestational diabetes. When pregnancy is confirmed, we will stop oral hypoglycemic agent and we will start insulin plus MNT. We will give aspirin to prevent PIH. And remember, OHA is contraindicated in the pregnancy. Now, exception is that in gestational diabetes, if the patient refuses to take insulin, we can give metformin or glyburide. But we will not give this in pre-gestational diabetes. Only it is given in gestational diabetes. Complication of diabetes. So we are divided into three, that is maternal, fetal, and neonatal. So maternal complications are the increased risk of infection. That is, patient will come with asymptomatic bacteria, candidiasis, or placental issues, that is PIH or polyhydramnios. Polyhydramnios can cause PPH, premature rupture of membrane, PTL, abruption or cord prolapse. Malpresentation can also be present, and there are future diabetes risk of 30 to 50%. So maternal risk increase infection, placental issue, then polyhydramnios can cause PPH or PROM, PTL, abruption or cord prolapse, and malpresentation. In fetal, if the case of fetal hyperglycemia, there is an increase in the fetal insulin. If the increase in the fetal insulin, it will ultimately cause the increase in size of the baby. So ultimately, it will cause macrosomia. There is no role of growth hormone in it. Increased risk, there is shoulder dystocia, abortion, IUD, stillbirth, IUD and oligohydramnios. Now neonate. In neonatal, if there is due to increase in insulin in the baby, it will ultimately cause neonatal complications. So first is 4 hypo. That is hypoglycemia, hypokalemia, hypocalcemia, and hypomagnesemia. Respiratory distress syndrome, necrotizing enterocolitis, and hyperviscosity will increase bilirubin along with polycythemia. Anemia and mental retardation are never seen in diabetic mother babies. Shoulder dystocia. So shoulder dystocia is delay in more than 1 minute in delivery of the shoulder after fetal head. It is OPS emergency. We can see turtle sign. Turtle sign is a head retracted against the perineum. I will remember it with the mnemonic of helper. Helper. H stands for call for help. E for episiotomy. L for legs. Legs means make robot maneuver. Make robot maneuver. You will flex plus abduct the leg. It will cause the straightening of the sacrum and we can easily deliver the head. Then P stands for suprapubic pressure. You will enter the head and you will rotate the head of the baby and it is called as a wood corkscrew maneuver. Then you will remove the posterior arm and roll the patient or put the patient in all four positions. That is all four of Gaskin maneuver. Now the nerve injured during macrobot maneuver is a lateral cutaneous nerve of thigh. Contraindication of the maneuver is fundal pressure. You will not give fundal pressure. You can only give suprapubic pressure, but you will never give fundal pressure. Last resort maneuver, that is when everything fails, you can go for Zavanelli maneuver. And most common fetal complication is Erb's palsy, that is C5, C6 nerve root is involved. Also called as a policeman tape hand position. And most common maternal complication is postpartum hemorrhage.